The Sinai Medical Foundation Oral History Project is being conducted by Leonard N. Simons Jewish Community Archives. My name is Michael Burke, and today's date is November 6, 2023. I am interviewing Dr. Morris Brown. Dr. Brown, do you give permission to the Leonard M. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes or for use as deemed appropriate by the archives?
I do.
Good. It's a good start. So let's start at the beginning. Where were you born?
I was born in Richmond, Virginia.
How did your family get to Richmond, Virginia?
My father was in the military. So he was in the Army stationed there, so that's where I was born.
On base? Did you live on base?
I believe that we drove to Richmond because of the medical care there. My father knew folks there, and so he drove my mother to Richmond. They were actually stationed outside of Richmond.
How long ago was that?
72 years ago.
You're a kid. Who inspired you to become a doctor? Did you always want to be a doctor? Let me guess.
Pretty much. Came from a family of doctors, and my father obviously influenced me tremendously.
I just have to say this because your dad said it. He said, in our family, being a doctor is a dime a dozen.
Right. Exactly right.
He made me laugh. So I'm editorializing here, but that was a funny line. I thought you'd. Where'd you go to medical school?
Went to medical school at Wayne State.
And was it a good experience there? Did you
yeah, I loved it. I thought I got great clinical experience. I enjoyed my time there.
Now, there was a relationship between Wayne State and Sinai Hospital.
Yes, there was.
So did you participate in that activity?
Oh, I did a lot of my medical school rotations at Sinai. I picked obstetrics and gynecology. I did my psychiatry there. I did medicine and some medical subspecialties. It was a great opportunity.
Was there a crossover between the professors at Wayne State and Sinai Hospital?
There was. They were teaching faculty, and in fact, I believe there were two of the services where the chairmen at Sinai were the chairs of the Wayne State University School of Medicine departments. I know one was anesthesiology, because my father was the chair there, and I think the other was psychiatry with Norman Rosenzweig.
So describe your residency.
Well, my residency was not at Sinai.
Tell me where it was.
So I had, when I graduated medical school, I started an internal medicine residency. I had matched a program in Boston at the New England Deaconess Hospital and completed internal medicine residency there. But I wanted to pursue a career in critical care medicine. So my choice after graduating internal medicine was to either do a pulmonary fellowship or an anesthesiology residency, because there were no critical care fellowships as yet. And I chose to do a residency in anesthesiology in order to gain some additional skills, technical skills, intubations, invasive line placements, get comfortable with acute care medicine. So I completed an anesthesiology residency at the Massachusetts General Hospital in Boston.
Good experience?
Great, great. They had some of the folks that were really pioneers in critical care medicine were there. And they helped influence me to pursue my career in critical care medicine.
Was there any thought that you would stay there?
There was. In fact, I was offered position there when I finished, but decided that for my own growth and development, probably going elsewhere would be best, maybe with the idea of returning back to Boston and the Harvard system at some future point. But I then started to look at academic positions elsewhere.
So where else did you look, just out of
In
curiosity?
particular, I was pretty close to accepting a position at the University of Pennsylvania. They were also trying to initiate a critical care program for their anesthesia residents. And I pretty much had decided to accept a position there when I was called by another hospital in the Midwest. Actually, it was in Ohio. It was not a university program. It was a university-affiliated program. And they had offered me a great deal to try to look and come to their program to start a critical care program. So, of course, I called.
Was that like a new critical care?
It was brand new.
Brand new?
There were in its infancy. And people hadn't quite figured out what to do, but they knew that they wanted to expand their programs for primarily patient care, but also for resident education. So when I had that offer, I called my father, of course, and said, "Do you know about this hospital? They're offering me the world." And he told me he was familiar with it, but if I were going to be looking at that hospital and not staying in a university in a full-time academic program, that he thought I ought to come to Detroit and take a look at the same job at Sinai, because they had the same opportunity. And at that point I said, sure, be happy to. It was a nice opportunity because my brother, who was finishing his vascular surgery fellowship at Mayo, was also considering coming back to Detroit. And his kids were about the same age as my kids, and my wife's family's from Detroit, so there was a lot of appeal to come and look at Sinai Hospital.
So how did you find Sinai when you, the environment there when you?
It was amazing. It was unlike any hospital I had ever been in.
Give me a description.
Mostly because it was comfortable, it was friendly, and yet it was really academic. These were outstanding physicians, but the collegiality was unlike anything. And I had been in a lot of hospitals at that point, between the two residencies and rotating through different institutions. And I have to say, since that time, I find it the same, because I've been at other institutions. It was just a very welcoming environment.
Was there a Jewish factor in that?
Great, unbelievable Jewish factor in that. Being able to feel comfortable with my Judaism, which was an important part of my life. It was just very welcoming. It was a great work environment.
Now you explored other possibilities around the country before you came.
I did.
Did you find any issues of your Jewish identity when you went?
Not overtly. Not overtly.
Could you sense anything?
At that point, when I was looking, I think there was a sense that it wasn't, well, let's just say it wasn't as welcoming, and I wasn't as comfortable as I was at Sinai. And certainly my own experience just through residencies and trying to get holidays off, Jewish holidays, was always a challenge. Not so at Sinai.
Now, I've been told that Sinai Hospital, at its height in terms of Jewishness, there were about 65% Jewish doctors. And how did the non-Jewish staff feel about working in an environment with 65% Jewish doctors?
Oh, I think it was just a very welcoming environment, generally. Jewish, not Jewish. It was a very, it was still high-level medicine was practiced there. I think it was also unique in that not only were physicians collegial, they were even more than that. They were friends. I can tell you in most institutions I was at, if you'd go to the lunchroom, you wound up sitting with the same group of people in your department. Not so at Sinai. You walk in, you were comfortable anywhere, and you sat with people that worked in multiple departments.
Still friends with some of these guys?
Sure am.
And gals?
I sure am. To this day.
Now, you said that your dad said you should come and explore. What role did he play in making you make the decision to come and stay?
Well, I think the fact that I got a chance to work with him, and that was really appealing to me.
How was
to be able
that?
to be here. Oh, it was fantastic. Not only did I learn a great deal from him, in terms of just general anesthesiology, because while I did go do an anesthesia residency to practice critical care medicine, funny thing happened along the way. I really enjoyed anesthesiology. So while I did practice critical care exclusively, probably for about 10 years, I eventually came back to anesthesiology. And I learned a great deal of that field, but also about administration from him. And it was just a great opportunity for me. And I'm delighted, never regretted it a day that I was able to work in the hospital with him and my brother.
Very fortunate.
And very fortunate.
Tell me a little bit about critical care. What exactly is it? And you were sort of at the embryonic stages of it.
Exactly.
So I'm curious how it's evolved even over the years.
So critical care medicine is really an opportunity to take care of intensive care unit patients. And at the outset, it was a little challenging, even at Sinai.
Yeah, what are
because
those
nobody
challenges?
Nobody really knew what to expect. And the idea was that this was an area of interest and expertise of mine where I could manage critically ill patients on arrival to the intensive care unit, do it in a cost-effective manner and a more efficient manner so that the length of stay in ICU was shortened and the cost to the institution was less. And people weren't quite sure what to do with that because in the past, people mostly, and I worked in the surgical intensive care unit, surgeons would admit their patients to the intensive care unit, manage them there, and then they would be transferred out to the general surgical floor and then home. But unfortunately, most of the time, surgeons are either seeing patients in the office or in the operating room, and say they weren't really readily available. And if patients were well enough that they could be managed by rounds in the morning and rounds in the afternoon, probably didn't need to be in the intensive care unit. Those that did require intensive care unit care really deserved ongoing moment-to-moment management, which is what I had to offer. And over the course of time, it's really developed. There's now a separate specialty of critical care medicine that has many avenues. You can enter critical care medicine through internal medicine, anesthesiology, emergency medicine, surgery. There are a multitude of disciplines that can access critical care training now. But at that point, there were no fellowships, there were no certifications. Turns out that we started the American Society of Critical Care Anesthesiologists. And to let you know, I was at the infancy of that. I have certificate number 3.
Wow.
So, and I was in the first group of physicians who were certified when it became a recognized specialty.
Did you work with your dad on any of the cases when you were at Sinai?
I certainly did. I did. It was really fun because, a little confusing, you might say, because my brother's a vascular surgeon. So if his patients came in, they might have Dr. Brown as the anesthesiologist, Dr. Brown operating on them, and Dr. Brown taking care of them in the intensive care unit post-operatively. So it was a really unique but delightful experience. It was just fabulous.
Yeah, so were you doctor, or doctor, father, son?
No, it was Dr. Brown. And when patients asked for Dr. Brown, of course, the next follow-up question, which one?
Um, Let me ask you, when did you find out that Sinai was going to be sold?
Well, interestingly, at that point, my father had retired, and I had assumed the position as chairman of the Department of Anesthesiology. And so this was now in the early mid-90s, and that's when we started to learn about the possibility of the sale of Sinai. At that point, I think most of us came to recognize that the day of the independent hospital was coming to an end, that most institutions needed to become part of a larger healthcare system in order to survive, and that the number of healthcare systems even those were going to be limited. So it became a little challenging at that time because I think everybody saw the writing on the wall.
You know, it was, I'm editorializing here, so you'll forgive me. It was a demographic issue.
Clearly.
The Jewish community was no longer coming to Sinai Hospital anymore. Or,
I think that's absolutely true.
and there are some who I've spoken with and said, we made a mistake by not building, you know, out in the West Bloomfield area. How do you feel about that?
Well, I have a unique perspective on that because when Sinai closed, I went to Henry Ford.
Well,
And there was discussion between Henry Ford and
Exactly.
Sinai about being in West Bloomfield. So of course, that would have been ideal for me. And I would have loved to have seen something like that. And to continue Sinai in that form would have been, I think, just a great opportunity. Sadly, that didn't happen.
how was the change in culture at the hospital? How was that addressed by the physicians who were there as you were sunsetting?
Yeah, that was a difficult time. And it was a difficult time because I think the staff was trying to figure out what to do next. We had a group, well, I need to go to Beaumont. Well, maybe I'll go to Providence. Well, maybe after the merger with DMC, I'll just continue with DMC. And so there was a lot of fragmentation. And so the cohesiveness that was so unique at Sinai started to fracture a bit. And people were kind of figuring, what's next for me?
And that, I would assume, led to the disruption of the homogeneity of...
Absolutely, that's exactly right.
Now, did doctors find it difficult to go to other hospitals? Were they accepted?
Yeah, I think at that point, unlike when Sinai was opened, it was easier because people were, at that point, I think most of the hospital systems were looking to add physicians to increase their roles and bring more faculty on. And so I don't think they had quite the same roadblocks that had existed before Sinai opened.
I'm looking for the question. What was your favorite part of working at Sinai when it was at its height?
Oh, there were so many things that I
Well, I'd
enjoyed
like to
about
hear.
Sinai. I enjoyed the people, first and foremost. The people I worked with, I respected the physicians that were there. I think they were outstanding physicians. The environment, the esprit de corps in the hospital was, again, as I said, unlike anywhere I had ever been. I had the unique opportunity of working with my father, and so that was a special thing for me. It was just a very friendly but outstanding clinical, and we had so many opportunities. We could do research if we wanted to do research. There was a great research opportunity. There was great clinical care there. There was outstanding teaching opportunities there. It was basically a full-time academic environment without having the bureaucracy of the medical school.
Was there anything that you didn't like at the hospital?
There's politics at every hospital.
Well.
And those always sometimes get in the way. And towards the end, that started to be a little bit more of an issue as resources started to
Give me an
be
example.
be a little more scarce, and people were trying to figure out what to do next. Um, that became a little more of a problem.
How'd you feel about the community's support of the hospital? And as we sort of went through this decision, did the hospital doctors feel betrayed by the community at all?
You know, I think they, well, I don't know how others felt.
Well,
I can tell you how I felt.
okay.
And I don't know that it was as much betrayed. I'm much more of a realist and a pragmatist. I saw what was happening, and the community was moving away. And we're really moving more to suburban sites and hospital sites, whereas before, first the community lived around the hospital and used it, and then they continued to use it when they started to move away, but as they continued to migrate away, they started to use other facilities. And so it was a little bit felt abandoned in that way, but understood.
And what was the discussion among the doctors as this whole process was going on? Did they feel like they were a part of the decision making?
Not so much, probably not. I think these were, I think, more financial decisions than much else, I think. And I think most of the physicians, while they didn't like it, understood it.
Yeah, you think that there was an understanding by the doctors, they didn't feel like the hospital should have remained there? And
Oh, I think the doctors definitely wanted the hospital to remain there. But the realities were the realities. And as much as we wanted it to stay and wanted to keep the group together and keep everybody there, I think it became more and more apparent that that was going to be very difficult to do.
Now, you alluded to the fact that it was more difficult to get things done, supplies, et cetera, et cetera. Was the quality of care affected by the sale and the progress?
You know, I don't think quality, this was, again, I'll reiterate, an outstanding group of physicians who had patient care as the highest priority. Now, I think there are concerns about resources in order to provide that care, but I don't think the care suffered, at least not by the physicians and nurses that I worked with. I think they were all still committed right up to the end.
Tell me about the nurses. Did the nurses have difficulty finding other employment as you move forward?
Not that I'm aware of. I think, again, that's consolidation was happening around the community.
And was there an impact in the relationship between the nursing staff and the doctors as this process was
I
going
didn't
forward?
feel it. I think everybody sort of felt the pressure together.
Mm-hmm.
This was, it was a difficult time for everybody in the hospital because we wanted it to go on and be back at sort of like the good old days, but
Yes, now the Jewish community is starting to move back to Detroit.
right.
Go figure.
Right.
Who were some of the people, you talked to obviously your father, who were most influential and mentors to you as you...
Yeah. Well, he was probably the prime one, obviously.
I understand that.
But there were 4 physicians at Massachusetts General Hospital that were real pioneers in critical care that influenced me and really got me interested in critical care and critical care research and critical care administration. And those were Henning Pontoppidan, Roger Wilson, Dick Teplick, and Dave Cullen. Those were really 4 giants in critical care that influenced me.
Anyone at Sinai besides your dad?
Well, so many people. You know, I had a very close relationship with the Department of Surgery, and surgeons were just an outstanding group of people. And while at the outset there was some challenges for me coming into the surgical intensive care unit as a non-surgeon to care for surgical patients.
Tell me about that.
Well, as I said, there was not a lot known about what was going to happen with bringing in a critical care physician, because there wasn't really anything like it before. So when I came in, I think there were some who said adamantly they did not want me to care for their patients. There were others who were delighted that I was there because they didn't have to care for their critically ill patients. And I would say the vast majority of surgeons were kind of in the wait and see. They didn't know what was going to happen. And so over time, those that wanted to care for their own patients, that's fine, go right ahead. I still would round on those patients with residents and fellows so that we could keep up to date, so that, again, the one thing that I insisted on when I came was absolute admission and discharge authority. So that, because in the past, there were those who would keep patients in the ICU for extended periods, it was easier, they got better care there than they felt on the floor. So those that wanted me to care for their patients, I did, took full care and responsibility and just notified them of any major changes in their patient status and when they were discharged to the general units. And as other surgeons admitted patients to the unit, I would assist them with the care of their patients, because we had a 24/7, 365 care for those patients in the unit.
How big was your department?
So when we started, I was the only critical care physician. We did have residents from anesthesiology, from surgery. Then we had rotators from internal medicine, from pulmonary medicine, and cardiology that would rotate with us. So we would have residents take call at night, and I was available full-time. Subsequently, I trained additional critical care fellows when we had the fellowship, and so I brought on additional faculty and a fellow as well as residents. So it was a small department, and it was really basically within the confines of the Department of Anesthesiology. So we were able to provide full-time coverage, and over time, even those physicians that were adamant at the outset that they didn't want me caring for their patients suddenly realized that they were getting a lot more calls that none of the other surgeons were getting, because we would care for them. And so ultimately, I basically took care of every admission in the ICU. And I think it improved patient care. I think it was more cost effective and more actively involved. And at that point, I was much more comfortable at Henry Ford and had brought on additional faculty. And so that was running pretty smoothly, and thought this would be a time that I could get involved with the Sinai Medical Staff Foundation, which I did. And so I joined the board of directors, and I have been delighted to be a part of that ever since. It has been a great experience, not only reuniting with some fellow Sinai colleagues, but to be able to give back to the community.
Share how.
Well, we review grants for different opportunities for research, for enhancing the care in the community. And we have been able to do some really very nice and gratifying grants to the community, both the Jewish and the community at large.
Give me a couple of examples.
We have funded an educational opportunity for a simulation laboratory. That was at Henry Ford. We've funded research at the University of Michigan. We have funded medical students to help and assist with them. We fund Tamarack camps in their infirmary. There's so many, and we're continuing to do it. It's an ongoing, and it's very gratifying.
Do the people who are recipients of our largesse understand where the dollars are coming from?
They do. They do.
And that it's...
And we ask that they acknowledge where it comes from, just so that it's to complete the circle.
How big is the board?
You know,
Ballpark.
Ballpark, maybe 15 folks.
And as a,
I don't know exactly, because we go up and down. Some people join.
and as a board member, you said are the projects reviewed as a total board, or does the board take specific things to present to the board? How is the mechanics of giving grants out?
Well, we have a subcommittee that reviews all of the grants that come in. And then what they'll do is review them, give them a generic kind of overview, and then bring it to the entire board. And then the entire board gets to vote on which requests are funded. Now, it's a process, so that it's not a one-time review. It might be there are additional questions and things we want to know more about in these requests. And so it's a pretty in-depth process to review, and everyone gets the voice and opinion, and then we have an opportunity to vote.
And the board votes as an entire body?
Everyone gets to vote,
Yeah.
Yep.
This may be an unfair question, but I'll ask it anyway. Do you know, ballpark, how many dollars have been given out from the foundation?
You know, I don't know off the top of my head.
It would be, it's something I'm going to find out, because
I can find out for you, because I do have that information. In fact, we had it, we did review it recently. I just don't recall.
I mean, the fact is that those dollars, they're millions, I know.
Yes.
But
Yeah.
I don't know the answer to the
Yeah.
question. I'm sorry that I asked it.
Yeah.
Anything that we've talked, that we haven't talked about that you'd like to? I want to talk about your family for a minute too.
Yeah.
So let's do that now.
Okay.
Tell me about your family and how they've played a role in your career and their careers.
Okay. My wife is Rhonda. She's actually from Detroit, as I said, was very influential in the decision that we returned to Detroit and joined the staff at Sinai.
What part of Detroit is she from?
She's from the 7 Mile. She went
Livernois.
not Livernois.
Wyoming.
No. She grew up on Stalen and went to Henry Ford High School.
Okay.
We have a daughter and a son. My daughter is married and lives in Chicago. She has 3 kids. And my son lives about a mile away from us in Detroit, and he has 2 daughters. So, obviously, family was an integral part of returning to Detroit because my wife's family was here. As I said, my brother was moving back here. My sister was here. My other sister ultimately moved back here. So family was a big draw to come back to Detroit.
And your dad?
My dad, of course. And he was the big influencer.
Yeah.
And so, yeah, they, in fact, my daughter's a physician. Her husband's a physician. Back to the dime a dozen. And my son's an attorney, married to an attorney. So family has been very important, and it was a great opportunity to come back to Detroit.
Do any of your doctor children work with you?
No. My daughter's a pediatrician in Chicago. She works in a group practice. And my son-in-law is an interventional cardiologist that works at Rush. So, and I don't think we have much of a chance to get him back to Detroit, even if I had a job to offer them. They're very happy in Chicago.
Chicago's a good place.
Yeah.
My son-in-law comes from Chicago,
Yeah.
but he's here now.
Lucky you.
Lucky me.
Yeah.
Anything else that you can think of that you'd like to add for the record that we haven't discussed?
No, I'm delighted that this project's moving forward. It's such a unique, and it was a unique institution. And I think, and I hope you're getting that sense from everybody that you've had a chance
Absolutely.
to talk to. It is, and we all bemoan the fact that we don't have it, but are so grateful that we did.
And I think probably another uniqueness I'm editorializing is the foundation. The fact is that we took the funds from the sale and have created an instrument that does extraordinarily good things in the community. And the Sinai name will continue, which is, I think, very important.
And it also gives some of us that were on the staff a chance to still get together.
Exactly right.
And be together.
Yeah.
So it's really been wonderful. So thank you.
Thank you. It's been a pleasure.